ever wondered what actually happens in therapy, or if your therapist is secretly judging you? As a therapist, I hear these questions all the time. So today we're going to break down the top 20 most pressing questions about therapy and mental health, even the ones that people are afraid to ask. My name's Elena. I'm a registered psychotherapist qualifying here in Ontario. My goal is to make mental health clear, accessible, and less intimidating. So let's jump straight into it. Number one, how do I know if I need therapy? Therapy isn't just for people who have a diagnosed mental health disorder or are going through a very specific hard time in their life. Therapy can be for absolutely anyone and everyone. Obviously, if you're experiencing certain challenges in your life, whether that is connected to your mental health, interpersonal relationships, grief, finances, workplace, whatever it is, therapy may be very beneficial for you because it helps to have someone else to talk to and work through these problems with. However, therapy can also be a nice outlet where you can chat to someone about the various things going on in your life. So anyone and everyone can benefit from therapy. What actually happens in the therapy session? This is going to vary so much based on who you work with and the type of client that you are. But a typical session with me looks like you coming in, we do a check-in of what it is that's been on your mind the last week or so, however long we haven't seen each other. And together we kind of guide what you would like to focus on for this session. It looks a lot like you talking, me asking you questions, me pausing, giving you some challenges, some reflections, and us kind of working together to figure out what is best for you in this scenario. Sometimes there's going to be a little bit more education involved. Sometimes there's a little bit more assessment. However, every single session varies a little bit. I have some clients who spend the session telling me about their life and various issues that they've gone through, and sometimes it feels more of like a chit chat, whereas with some clients, we spend a lot more time on psychoeducation and deep trauma work. So it really varies based on what you want. How do I choose the right therapist for me? There are so many therapists out there. It's a very booming field, and it can be very daunting to go out there and pick someone who you think you can trust, who you feel like you'll be comfortable opening up to. What I suggest is searching up for various therapists in your area who specialize in the work that you would like to do. Here are some areas where there's a lot of therapist directories. Book a consultation. Most therapists will offer a free 15 to 20-minute consultation where you can ask them about their style. You can tell them what it is that you want to work on, and you can see what plan or what approach they have for you. At the end of the day, you want to pick someone who you feel like you can be super open and comfortable with. The therapeutic relationship is one of the most important factors. So it's very important to find a therapist that you feel like you can be very comfortable with. And that may vary based on their age, their background, their education, their specialties. I would suggest doing maybe 3 or 4 consultations and picking who you felt the most comfortable with and who you feel like is most competent for your specific needs. Is therapy worth the money? Listen, therapy is expensive. I know, I charge $145 a session. However, I have clients who have told me that this is some of the greatest investment that they have ever made in their life because what they have learned from therapy has been transformative in so many different areas in your life. I would look at therapy in the same way that you look at going to the doctor, going to the dentist. This is just another form of taking care of your health. You're taking care of your mental health. You're unlearning certain patterns. You are developing different skills. All of these things can very well be worth the money if you find that they're creating a positive impact in your life, not just in the present, but also for your future. So yes, therapy is 100% worth the money. However, you need to be committed to the process. So it's only worth as much as you put into it. How long does therapy take before I feel better? It's a great question, and it's kind of difficult to answer because that will vary so much based on, number one, what it is that you're dealing with. For example, if you're dealing with complex trauma, that might take a bit longer than someone who is dealing with maybe a workplace problem. Number two, how much time and effort are you willing to dedicate on your healing? For example, someone who's coming to therapy weekly may see benefits a lot quicker than someone who's coming once a month. You also have to understand that a lot of the healing and a lot of the work comes from outside of the therapy session. So what are you doing outside of our sessions that's going to be conducive to your growth? Most people see benefits within 6 to 12 sessions. I know for me, when I was going to therapy, I felt a lot better within about 6 to 7 sessions. However, it varies. I've had some clients who have a complete transformation of symptoms within 3 sessions. I have some clients that have been going to therapy for a lot longer than that, and they report feeling better. However, they still need a little bit more time to work on what they're going through. So it really will vary for everybody. What's the difference between talking to a friend and talking to a therapist? While you may experience a similar comfort level between talking to your friend and talking to your therapist, the therapist is a master's level educated person who has gone through a variety of training in psychology, neuroscience, biology, sociology, so that they can use evidence-based practices and modalities and techniques to best help you through whatever it is that you're experiencing. While your friend may offer you good support and advice, they may not have the same knowledge to actually provide you the practical skills that can help you with your various challenges. Talking to your friend, you may get advice. However, your therapist does not really provide you advice. Therapy is more for you to dig deep within yourself so that you can find the answer in the conclusion. The benefit of therapy is that you're getting someone that has the knowledge and guidance to help you through whatever it is that you may need. Do therapists secretly judge their clients? I can't speak for all therapists, but speaking for myself, absolutely not. As a therapist, you are trained to basically remove bias. You are trained to get into that session and turn off all preconceived notions, turn off all judgment. There is absolutely nothing that a client can throw to me that would throw me off guard, that would make me judge them. I've heard almost everything that you can think of, and nothing has really thrown me off guard. Anything that a client brings to me, I try to understand, why is it that maybe they're thinking this or feeling this? What has happened that has got them to this point? Or if they've gone through any very difficult situation that might be kind of taboo, I always find a way to empathize with them. And I never leave the session feeling like, oh, that was very strange, or oh, this client is, XYZ. Once I'm in that session, all judgment turns off. So no, your therapist should not be secretly judging you. And if you feel like your therapist is secretly judging you, then maybe you should switch to a different therapist who would be a little bit more open-minded. It's interesting because I will have clients who will say, I really wanted to tell you this earlier, but I felt like maybe you would judge me. And once they actually do share it, they realize, oh, wait, this is such a big relief because I know you're not judging me. Therapy is meant to be your safe space. It is not a place for judgment whatsoever. What's the difference between therapy and medication for mental health? Traditional therapy in the form of talk therapy is where you're working with a therapist. They'll usually use a variety of different modalities such as narrative therapy, cognitive behavioral therapy, internal family systems, dialectical behavioral therapy, somatic work to help you through whatever challenges you are presenting with. Many clients who come to therapy are also on medication. For example, maybe they're dealing with depression, anxiety, ADHD. For these various conditions, they are taking medication. Your therapist is not qualified to prescribe you medication nor provide advice on medication. Sometimes my clients will ask me, oh, I don't know, I was thinking about taking this medication. What do you think? What I can do is research some of the benefits, side effects, provide them with the scientific evidence behind this medication. However, it's not a therapist's place to tell you what you should do. Medication alone can be effective. However, medication paired with therapy is usually a lot more effective. And sometimes therapy itself can be more effective than medication. The medication will help the chemical imbalance if you are experiencing a diagnosed mental health disorder. Therapy will help you build the skills and the confidence to deal with that mental health disorder. How do I know if my therapist is a good fit for me or not? I like to look at three different things. Number one, comfort. When you go to the session, are you being yourself? Do you feel like you can talk about absolutely anything and open up to them? If you feel like you're hiding things from your therapist, which we've all been there, I've hid stuff from my own therapist too. Everyone experiences that. If you don't feel comfortable opening up to your therapist, then maybe they're not the best fit for you. Number two, understanding. How much understanding do you feel like your therapist has of you as a person and the situation that you're going through? Your therapist should be able to understand you to the best of their abilities so that they can work with you and both of you can collaborate on what the best way forward is for your well-being, for your mental health, for the various things that you are coming to therapy with. If you feel like your therapist does not understand you, they don't align with you, that may not be a great fit. It's important to also look at if you're looking for a therapist from a specific cultural background or you want someone to understand these unique nuances of your life, then maybe if your therapist isn't picking up on that, they're not a good fit for you. The third thing that I look at is, do you want to come back? After you've had a couple sessions with your therapist, do you feel like maybe what you're being taught there, what you're talking about, the way that you kind of click together, does that make you want to book another session and pay that fee again? If you feel like, this is just not for me, I don't feel like my therapist is understanding me, I don't feel like I'm getting what I need, and I don't want to pay to come back, then maybe your therapist isn't a good fit for you. Is it normal to feel worse before you feel better? 100,000%. I know from my personal experience, when I would go to therapy, I'd leave the session and I'd feel honestly not that great, but it's because there's so much that comes out in therapy and sometimes you have to take a little bit of time to process all of it. Sometimes you will uncover certain truths about yourself or your life, or you'll revisit certain past memories that don't really feel that great. However, once you can get past all of those, you will start feeling so much better. It's difficult to dig deep. It's difficult to sit there and face our problems. So yes, it is 100% normal to feel worse, but then things will slowly get better as time goes on and as you put in more of that work to heal. How do I open up if I don't know what to say in therapy? This is a good question, and I've actually worked with quite a few clients who sometimes would come to the session and they wouldn't have much to say, and I felt like I would kind of have to draw out a lot of their answers. And what I've realized is that sometimes people just want to be in a space where they feel safe. Sometimes it takes a little bit of time for them to warm up to you, and that's 100% okay. And you may take some time to warm up to your therapist. You may not be as open on that first session and give all the details, but maybe when you're 6 sessions in, you'll feel a bit more comfortable to be yourself. Your therapist will help guide you and ask you questions to make you feel more comfortable and break the ice. Slowly work so that they can build this therapeutic relationship where you'll feel a lot more comfortable talking about whatever it is that's on your mind. So it's okay if you come to therapy and don't have much to say or aren't really sure what to say, hopefully you can work together with a therapist that can help get you on the right track so that you can begin to express yourself. How do I know if I have trauma even if I don't remember it? Good question, but here's my take on trauma. You can take person A and person B, put them through the exact same traumatic event. However, only one of them might develop trauma while the other one doesn't. And that's because there's so many different factors that go into determining whether something will act as a traumatic event for you or not. Some telltale factors though are, for example, if you're experiencing nervous system dysregulation. So maybe you're always on edge, you're always in that. It might be the opposite, you're very down, you're kind of like frozen. Or maybe you're oscillating between being super hyper arousal and feeling nothing at all. Sometimes trauma can manifest itself as extreme anger and outbursts, irritability, feeling triggered by a lot of different things. If you're experiencing depression, suicidal ideation, sometimes we don't remember our traumatic memories. However, a lot of that is stored within our body. So let's say you're working with a therapist and you do some somatic techniques, which is looking at how these things are stored in our body. You may experience some release, and that may actually help bring back some of those traumatic memories. Trauma is very unique, and I'd say even if you've gone through some difficult events, maybe your brain has not taken them as being traumatic. So that's something that you want to work with a therapist to kind of find out a bit more about. What's the best therapeutic modality? The answer is there's no single best one. If we look at the evidence, we can say CBT, cognitive behavioral therapy, is almost the gold standard for a lot of conditions like depression and anxiety. However, your therapist will most likely use a blend of various modalities to best fit you. There are certain techniques, certain kind of theories from each modality that might fit best with who you are and what you're going through. And your therapist will be skilled in kind of picking and choosing to create more of like an eclectic approach. It will take whatever it needs from all these various modalities that are all rooted and backed by science to fit you. So there's not one best approach. There's not one single approach. If you are looking for a very specific approach, there's usually programs that you can go to that are just CBT focused or just DBT focused. But additional talk therapy, you will most likely use a blend of a few. Can therapy help me change my attachment style? Yes, therapy can definitely do that. Therapy can help relationships and attachment styles by showing you various perspectives and giving you a third-party person who can help work through a lot of the interpersonal struggles that you may have. Therapy can also teach you about your attachment style and what has sort of formed it, what keeps it stuck in that state, and teach you different techniques so that you can feel a lot more secure. I've worked with so many people who have come to therapy being extremely anxious and have learned to be more secure in their relationships. I've also worked with people who have come to therapy as avoidance and also learned to be more secure. The cool thing about attachment styles is that we have so many different ones. You know, you might act one way towards your parents, one way towards your friends, one way towards your partners. What this means is that they're dynamic, they can change. And just because we've sort of been raised a certain way and we have one attachment style, it doesn't mean that that is what we're stuck with, because we can always change. Therapy can help you become a lot more secure and confident in your relationships. Can therapy actually change my brain? Yes. So there's this concept of neuroplasticity, and it's basically happening all the time. Our brain has millions of neural networks that it creates. And as we learn new things, as we grow, as we practice new skills, we are basically creating new networks. When you use a new skill over and over again, that neural network that is associated with that skill becomes stronger. And eventually, an old neural network, let's say an old neural network associated with a toxic trait or something more negative that you've been doing, isn't practiced as much, that neural network will basically die out, and this new neural network that you've been practicing and that you've been associating with more will become stronger. And this is happening at all times in your brain. The way that this works is when you're in a therapy session, a lot of times your therapist is mirroring you, whether that's with the tone of their voice, the way that they're speaking, their body language. There's certain neurons firing in their end. They're feeling empathy for you. They're able to sit there and regulate themselves, and their neurons are basically mirroring to your neurons that you too can be regulated. You too can feel calm. You too can get through this. The thing that your therapist is mirroring to you is what will also ultimately help you heal. So yes, therapy can 100% change your brain. Why do therapists charge so much money? That's a good question. So by the time you become a therapist, you've already gone through your entire undergrad, which is 4 years of school. For most people, that's about like, let's just say like 7,000 to 8,000 per year. And then you go through a graduate program. My program cost about $40,000 because it was a private university. And then you usually do additional trainings on top of that. So you already are very highly qualified and highly skilled. And based on all of that schoolwork, you know, there's some compensation that you kind of expect to get in return. Second, it is a very mentally exhausting and draining job. And, you know, people can be like, oh, you know, sitting there and like listening to people and helping them is easy. It's genuinely not. And I do think that the price justifies the work that you're putting in because of how like mentally draining and exhausting it can be for some people. In addition to that, it's kind of similar to other healthcare related roles. At the end of the day, mental health is still part of our entire health, and doctors are billing similar rates to insurance companies. Dentists are billing similar rates. Other healthcare professionals, for example, massage therapists, physiotherapists, they're billing similar rates. So this all falls within the same line. Beyond that, though, therapists aren't working 40 hours a week, because if you're working 40 clients a week, you will lose your mind. Usually people are working between 10 to 25, 30 maybe, if they're really pushing it. They are paying more per hour, but therapists are working less hours in general, therefore it kind of balances out. Why don't therapists give advice? Simple. It's not our job to. Our job is not to give you advice. Our job is to help guide you through your challenges and help you uncover answers for yourself. It would be kind of unethical for me to sit here and tell you this is what you should do, this is what you shouldn't do, this is what I think. If you specifically and explicitly ask me for my advice, I might give it to you. And sometimes I am a bit more blunt with my clients, especially if I've been in a similar situation. For example, there's one client and I've literally gone through everything that he's going through, and I always tell him, like, listen, this is how I experienced it, this is what I noticed, you may notice the same things. Giving advice is not part of helping people. Therapy is meant to kind of empower you, and we can't empower you if we hold your hand and give you everything. Think of your therapist as throwing you a life vest, right? You are still the one swimming, you're still the one that's going to have to propel yourself back to shore, but your therapist is that life vest, giving you the additional support that you need. Why do I self-sabotage even though I really want to change? There are many reasons as to why that can be the case, but what I've noticed in my own life and in my clients' life too is that sometimes when we want to change and we want to step into a new area of our lives, it feels uncomfortable because we have to basically say goodbye to our old identity. Shifts happen by changing our identity, right? By changing who we are, by changing the way that we show up, by changing what actions and behaviors and thoughts that we have. However, when you have a huge part of your identity connected to maybe specific trauma, specific situations, to this version of you that carries all the pain, that version is clinging because it still wants to be seen, it still wants to be heard. And when you start making changes, it sometimes feels like death to that old version, which can be scary, which can be difficult. And therefore, sometimes we don't get to that new version of ourselves because we can't let go of the old version. And this doesn't always happen consciously. Obviously, there's many other reasons as to why we self-sabotage. Sometimes we just don't think we have it within us. Sometimes we don't have the discipline. Sometimes there's other external life circumstances that happen. But I feel like this is one of the number one things that I see. What's the biggest misconception about therapy? I think the biggest misconception about therapy is that you're going to come to therapy and you're going to have your entire life transformed just by talking to somebody. And it is absolutely not going to work like that. The only way for things to change in your life is through you. It's not through me. It's not through your mom, your dad, your sister, your cousins, your friends, family, boyfriend, girlfriend, whoever. It's through you. Change has to happen within you. So you can come to therapy. You can talk to me every single week. You can talk to me every single day. If you don't go home and make any changes, if you don't use any new techniques, if you don't make any shifts in your mindset, if you don't reframe any of your thought patterns, you don't go and change any of your behaviors, if you don't do the things that we're actually talking about in therapy, then you will not see a change. You may feel a temporary relief when you come to the session and talk to me, but in your day-to-day life, it's going to remain stagnant because it all comes from you. And it is a sad, unfortunate reality that nobody is going to come to fully save us. Yes, we might have people there that are going to support us and drag us out of even our darkest times, right? But if you don't do the work, then nothing's going to change. Is my therapist just keeping me in therapy so that they can make more money off me? No. I've had some clients who've seen a complete transformation in all of their symptoms within like 3 weeks. I've had some clients that have been with me for a long time, and it's not because they're going towards a specific goal of transforming certain symptoms, but because they just want constant therapy and kind of like the support in their life. It's on your goals. Your therapist will know if you should be here or not. If I have someone that's coming to therapy and I feel like they're doing really well, I'm always going to ask them, okay, hey, like we kind of reached everything you wanted to do. Is there anything additional that you want to kind of add to our arsenal? Or do you just kind of like want to keep coming back and having these chats here and there? Most of the time, people just want to have the chats. On the other hand, too, if I feel like someone's coming to therapy all the time and is not reaching the goals that we have kind of put together, or I feel like therapy is not benefiting them as much, then I'll also tell them that. Like, hey, I noticed you've been coming to a bunch of sessions. Doesn't seem like you're really getting a lot better. Is it something that we can change here? Do you think that maybe there's another route? Like, would you like to maybe go to a psychologist or a psychiatrist or something else? So no, your therapist is not going to keep bringing you back to make more money because that's unethical. At the end of the day, our biggest priority is you and your well-being. And if you come to me and say, hey, you know what, Elena, like, I'm good, I'm done, I've done everything I need to do and I don't need therapy anymore, I'm not going to sit there and try to convince you to come back. I'm going to say, I'm so happy for you. Thank you. I'm always going to be here if you need something, and I wish you well. What is your therapy hot take? Okay, this one might ruffle some feathers, but basically, you do not need to unpack and therapize everything that has happened to you in your life. So, something that I always tell my clients who come in and have dealt with traumatic or difficult situations in the past, I always tell them, listen, if you don't feel like you want to go back and kind of like open up this Pandora's box, if you don't want to look at these events as traumatic, we don't have to. We don't have to go through and break down your trauma. It doesn't have to be this big thing, this big deal if you don't want it to be. There's certain things that have happened in my life that I could sit here and analyze over and over and over again and probably feel like shit every time I reanalyze them. But I kind of choose to leave them there. Like, you know what? They happen. I'm finding a way to accept it. It is what it is. And I'm not going to open that door. Obviously, this is subjective for everyone, but I'll give you the example of when I was going through a breakup a couple of years ago. I talked about it every single day for like 5 months to my friends. It was the only thing on my mind for so long, constantly talking about it, constantly thinking about it, constantly reopening all these wounds, the same wounds over and over and over again. And I felt like shit for so long because I was so stuck in it. The next time I went through a breakup, I gave myself like a week or two. I talked about it with my friends. I felt everything I needed to, cried, did all that. And then I'm like, you know what? Today it's done. It's done. I kind of just decided I'm not going to focus on this anymore. I'm not going to talk about it with my friends. I'm going to try to focus on other things. And guess what? It's not that those feelings and the pain just went away all of a sudden, but I was able to manage it so much better because it wasn't on my list of priorities. I wasn't sitting there and constantly re-engaging in the topic. Therefore, what I'm trying to say is that not everything needs to be broken down so much if you feel like you don't want it to be broken down so much, because I do think that sometimes when we sit in something for so long, it does end up making us feel worse. Therapy could be a place where you go in and heal all of that, heal the things that you're going through from the past. However, you can decide to do that in a way that feels like you're not just reliving it over and over and over again. And that's why there's so many different ways. Like, there's different types of trauma therapies that really help with that without making you go back and relive the situation. So that's my hot take. If you've made it to this part of the video, thank you so much for watching. This is question number 20. And actually, this is not a question for me, but it's a question for you. Is there anything else that you would like to have answered by me, a therapist? Is there anything that kind of came up in this video that made you think a little bit and you want more clarity on? If so, please drop it below in the comments. If you learned anything, let me know. If you don't agree with me with something, let me know. I'd love to hear from you if there's any further questions. If you watch this video and you're curious about working together, you can press the link down below to book a free 15-minute consultation. This is Canada-wide only. We can talk about what it is that you want to work on and we can see if we're a good fit. So thank you so much for watching and I wish you all the best. Bye.